with the plan. But Madam President, in 2006, 2007, NHI was supposed to be the plank to return the incumbent government. It was a scandal-ridden government, but it was the incumbent government. Little did I expect the firestorm that blew up over those comments. And in 2006, I came to understand a simple truth about politics in the Bahamas, that political expediency sometimes trumps reason, common sense, and for some, it's a perfectly good altar to sacrifice the reputations of anybody or everybody who would dare to speak truth to power. The onslaught from the other side was over the top. And Madam President, in 2006, for the first time, I put on a red shirt because I believe my conscience required me to align myself with an organization committed to honesty, intellectual integrity, and transparency. I participated in the administration from 2007 when that administration took over the government. By that I mean that I quit my job at Doctors Hospital as Vice President of Medical Affairs, and I went back into the public sector full-time, ultimately serving as the Chief of Surgery and the Chairman of the Medical Council. And we made significant progress with the delivery of health care, incorporating major capital developments, which became the critical care block, the introduction of the National Prescription Drug Plan, the expansion of the medical school, etc. 10 years later, Madam President, and 1,000 murders later, I remain here, a little bit older, I hope a little bit wiser, but no less committed to working for my country. So today, I stand in this place for the second time. I wish to thank my leader, Dr. Hubert Minnis, for the opportunity to serve in this capacity. The debate over NHI has arisen yet again, and yet again. Instead of a respectful discussion, stakeholders, other than the Bahamian public, who are the most important stakeholders, have been described in the most unsavory, indecent fashion. The Tribune reports, a report by Francesca Brown of the Tribune, describing the National Insurance and Labor Minister Shane Gibson, describing that doctors are greedy. Say they're only in the business for money. I'd like to invite Minister Gibson to come into an operating room when we're battling to save a young man and see whether we do it for money. The government's lead consultant posted on her website that the stakeholders are morons, and these are her words, Madam President, perhaps a bit unparliamentary, and money-grubbing asses.
Money-grubbing what?
Money-grubbing asses.
Calling doctors in the Bahamas that.
This is the government's Sanagest consultant.
Okay, you know, it's a foreigner. There's a foreigner saying that?
It's a Bahamian.
Bahamian. Oh.
The truth is, Madam President, that the state of our nation's public health care institutions have long since deteriorated. There are long lines, overcrowded wards, shortages of essential drugs, equipment shortages, disappointment, and anguish. Due to the job shortage and the economic downturn, many people cannot buy insurance. There's been a huge demand on the public sector, which has been unable to cope. This administration has sought to tackle the problem. I applaud them for it. What they refuse to do, however, is to listen to the people who can help them to make it right. Yesterday, a patient from Grand Bahama came to my office, 60 years old. He suffers from a weak heart, he has heart failure. He takes a number of medications. He went to accident emergency at Princess Margaret Hospital, which was overcrowded. He was slurring his speech. It turns out that he had had a stroke. He needs a test for his heart because his heart muscle is weak. And he may need a pacemaker, perhaps even open heart surgery. These things are expensive. Before coming here, Madam President, I had a young lady come to see me who was brought up in that other place by the Right Honourable Prime Minister, who needs coronary bypass surgery. She is a public patient. We cannot provide open heart surgery in Princess Margaret Hospital. But what we do is we have patients go over to Doctors Hospital, they have their surgery, and they go back to Princess Margaret Hospital. What we ask is that the patients provide the economic cost of the service. No profit, the cost of the service. When I came home in 1994, it used to cost $30,000. 22 years later, it is $40,000. And what has happened is the government now forces these same poor people to pay VAT on that amount. But they will take the names of Bahamian doctors, call them greedy. And what we are trying to do is to take care of patients in an environment where our hospitals' infrastructure is inadequate. Madam President, we can work together and build this country's healthcare system. I have expressed over and over and over my willingness to work with the government. But I will not support something that is nothing more than a political ploy. If we are going to do this thing, let us do it right. People can afford to go see the doctor. They cannot afford $10,000 or $20,000 or $40,000 or $100,000. So when we look at the components of our national health insurance plan, what we've suggested is that there's some things that ought to be included. Public-private partnerships, outsourcing of select services. We believe that there should be a national blood bank. One does not exist now. We believe that there should be an independent morgue, a coroner's, Quincy from the old show. That we should have, in addition to primary care, catastrophic care coverage for those people who come in with serious, life-threatening, limb-threatening, function-reducing illnesses. We believe there should be full-time consultants in the public sector. That everybody should be accorded the respect and the level of service as private patients get. We believe that we ought to have homegrown nurses and other professionals. Why should we have to import nurses and allied health professionals in 2016? We believe that we can elevate the quality of care, the ambience of care, that we can do it now. And if we eliminate waste, the amount additional that we spend on health annually will not be that much more. The catastrophic illnesses include cancer, dialysis, open heart, neonatal care, ICU care, rehabilitation services, etc. Madam President, building a country demands courage. No less a man than Sir Winston Churchill said that courage is what it takes to stand up and speak. But courage is also what it takes to sit down and listen. I had not intended, Madam President, as I closed, to address the referendum. But in light of the outturn of yesterday's referendum in Great Britain, it is interesting that the children of the Westminster system who adopt a policy of convention saw the demonstration by the Prime Minister of Great Britain,
True accountability.
who, having led an unsuccessful referendum, and just so that the people of this country know that when I went into the ballot box, I voted yes on all 4 questions. That is not the point. The point is that there have been 2 successive referenda by which the people of the Bahamas have rejected the lead, the policy of the government. David Cameron did the honorable thing. I wonder whether our Prime Minister will take that lesson. So, Madam President, I conclude by saying budgets are about choices. Budgets ought to inspire hope. This budget does not inspire hope, but the people of the Bahamas are anticipating that in this new day, that the people who serve in government are prepared to work on their behalf. Thank you, Madam President.
Thank you. Thank you very much, Honorable Senator, for most informative presentation. Thank you very much.